Welcome back to the IPE Guidebook. We've met the professions one by one. Now we ask how they fit together, by looking at the unique domain each profession holds, and the points where those domains connect. Healthcare is like an orchestra. Violins, cellos, flutes, drums, each instrument has its own distinct voice. Play alone, and you have a solo. Play together, in time, and you have a symphony. The professions work the same way. Start with what belongs to each, exclusively. The physician's domain, prescriptions, surgery, and medical judgment, theirs, and theirs alone. The nurse's domain, injections, wound care, and vital signs, together with vital psychological support. And the therapist's, the physical therapist owns function, the occupational therapist owns daily living, the speech-language pathologist owns communication. Now watch those domains interlock around a single stroke patient. The physician diagnoses and plans. The nurse delivers daily nursing care. The physical therapist leads therapeutic exercise. The occupational therapist trains daily living skills. The speech-language pathologist handles language rehabilitation. And the dietitian and educator manage diet and preparation for discharge. Information flows constantly between them, and the nurse is the link connecting the physician to the therapists. And here's the principle that holds it all together. A nurse cannot give a drug without a physician's order. And a physician must respect the nurse's bedside experience. These boundaries aren't bureaucracy. Respecting each other's boundaries, that, in itself, is patient safety. Let's recap. 1. Each profession holds an exclusive domain. 2. Around the patient, those domains interlock like puzzle pieces. And 3. Respecting boundaries while collaborating is what keeps patients safe. Next time, we close the season with the foundation beneath all of this, mutual respect and understanding among the professions. To go deeper, explore the full IPE Guidebook from Telios Books. See you in the season finale.